I just want to ask you also about the latest CDC situation report. It showed a test positivity rate of 20% among 10 to 14-year-olds. And I'm wondering what you think is behind that, because it seems to suggest that there's significant COVID transmission happening in schools and that perhaps these school-age children are spreading the virus to other age groups.
Yeah, so I think I would say that tells us, we look at the timing of when that was done. The testing was done as people went back to school, but the exposures and the transmission that we were seeing was over the March break for the most part. And yes, we are seeing increases, as we're seeing increases in all age groups in the community. We are seeing increases in children as well, and we are following that carefully. There have been a number of exposure events, as I'm sure you're aware, in schools, not surprisingly, related to the increase we're seeing in communities. And the communities where they're having the highest increase is the highest where we're seeing exposures. And that's because of transmission that happened over the previous number of days and weeks. So again, how important it is, if anybody in the family is unwell, get tested, do not go to work, do not send your children to school. That is important right now as we've seen the rates in our communities take off. And particularly if you were somebody who traveled, who had those social connections over that March break period, you need to pay attention that this virus is transmitting rapidly.